Let me explain it in a very layman term. Hematuria means blood in the urine. There are two types of hematuria. One is a occult hematuria and one is a gross hematuria. Something that your naked eye sees is called as a gross hematuria. And occult hematuria is one your naked eye cannot see it, but when you do a urine routine, or when you do an investigation of the urine, we come to know there are traces of blood in the urine. So in a nutshell, hematuria means bleeding from urine. There are numerous problems that can lead to hematuria. I'll discuss the more common problems. So three most common problems are the ones that I'm going to discuss. Okay. First one is infection. Second is renal calculi, that means a renal stone. And the third one is a cancer, which is a malignancy of the kidney ureter bladder. So let's go into one by one. The most common cause of hematuria in a younger age group, especially in females, it is because of a urinary tract infection. It is generally associated with fever and burning sensation while passing urine. The second common cause will be a renal stone. Renal stone, again formed in the middle age group, it is associated with severe pain. The hematuria that concerns us most as a urologist is a painless hematuria. The patient does not have any symptoms. He just says that the urine is completely red. He's not having any other pain, no burning, nothing, painless hematuria. That is a danger sign. It might indicate that he is harboring a malignancy that is a cancer within. Two symptoms that we commonly look and ask for is one, whether there are clots associated with hematuria. What do you mean by clots? Whenever we keep blood anywhere, it becomes a clot. That's what prevents the bleeding from being continuous. Whenever we get hurt, after some time, the bleeding stops because there is a clot formation. So we ask whether there is clot associated or not, because whenever there is clot associated, it means the hematuria is significant. Whether the other associated symptoms, burning sensation, pain while passing urine, it generally indicates infection. Again, if it's a painless hematuria associated with clots, it generally goes more towards cancer or malignancy. Pain associated with hematuria, severe pain in the bilateral flank region, in the region where kidneys are there, then we might consider a renal stone. So hematuria, again, two methods to diagnose. One is a gross and one is a occult. Gross hematuria, we don't need to diagnose. The patient himself comes with saying there is blood in the urine. It is the occult hematuria for which we require a urine routine microscopy, wherein in the microscope, the urine is checked whether there are any blood cells there in that. So this is how we diagnose whether hematuria is there or not. When should patients see a doctor? The answer to that will be having blood in the urine is not normal. Whenever you're suspecting a blood in the urine, be it gross, be it occult, you should be visiting a doctor because it is not normal to have blood in the urine. Whenever we talk about curing, for that matter, not hematuria, any problem, any disease that we talk about curing, the first thing that comes to our mind is what is the cause for it. Whenever we go to a doctor with fever, we never ask for cure of we ask for the cure of the fever, but what doctor thinks in his head is, what is the cause of fever? Is it typhoid? Is it malaria? Is it dengue? Is it any other infection? So first we need to find out the cause, treat the cause, the symptom will get over. So hematuria is not a disease, it is a symptom. We need to find out the cause of hematuria. The cause of hematuria, as I said, three most common causes: infection, renal stone, and malignancy. So we need to diagnose the cause of hematuria. How do we diagnose the cause of hematuria? We need to investigate. If there is an infection, we need to do blood parameters like CBC, CRP quantitative, urine culture, urine routine, and a sonography. That will help us to know whether there is infection or not. If it's a renal stone that we are suspecting, a sonography or a CT scan will help. If it's a malignancy or a cancer that we are suspecting, if it's a prostate cancer, then maybe a PSA test, a urine cytology for bladder cancer with imaging studies like sonography or CT scan. So yes, we need to find out the cause of hematuria. Once we find out the cause, it is 100% treated. Risk factors. So again, we need to find out the cause. The three most common causes, as I said, is infection, renal stone, and malignancy. Let us go one by one. Infection. Infection is generally seen in females. Why in females? Because they have a shorter urethra. The place from where you pass motion and the place from where urine is passed are quite near. So there is a possibility of cross infections. Male counterpart, they have a penis, they have a separate organ to pass urine. So the chances of UTI, that is infection, are lesser in males. So females, middle-aged, sexually active, are generally the most common age group in which we find urinary infection. In older age group, especially females, because of menopause, there is atrophic vaginitis. There is dryness of the vagina in the perineal region. And because of this dryness, it is the bacterial flora changes. The good bacteria dies off and the bad bacteria take over, hence infection in them. So yes, infection is covered. Next, we go on to the renal stones. Renal stones, most common males, middle-aged groups. Renal stones, there is many a times a hereditary tendency to form renal stones. People who stay in dry climate where there is a lot of sweating, there is lack of water, especially in countries like Gujarat, Rajasthan, in the interiors of Maharashtra, like the Marathwada region, where the climate is very dry. So the majority of the water that they intake is lost through sweat. Hence, there is less water available for the kidneys to pass urine. And hence, the calciums get precipitated in that concentrated urine. So, renal stones are more common in that age group. Cancers are generally seen in older age group, generally after the age of 50 years. All those who smoke, have working in paint industries, although a few of them have hereditary tendencies of forming cancer. Mother, there is history of cancer in father, grandfather, cousins, first cousin, mother. They have a more chance of forming cancer. Can we prevent hematuria? We have to prevent the cause of hematuria. How do we prevent urinary tract infection? So this is a very important part of the discussion that we are having. How to prevent urinary infection? So first of all, in females, what should be done? In females, maintain a very good hygiene. Whenever you are going to pass motions, make sure the hand does not touch near the vaginal area because that can lead to cross infection. Secondly, wash your vagina, especially during having bath. You can use whatever you want. There are commercially available products. There's no need to use them. You can use a simple soap that works equally better. After menopause, you might have to visit your gynac or your urologist whether there is a need of any estrogen supplementation that will help to keep the vagina healthy. Second, now commonly we get a lot of patients because they use spray. The jet spray is used while cleaning the vaginal areas while after passing urine. So what happens is many times the jet spray is very powerful. So what happens is it causes micro trauma to the vaginal area. It's very delicate. So whenever you use jet spray, make sure you do not use it in the vaginal area because it causes micro trauma. The area always being infested by bacteria, the bacteria gets an entry into the vaginal mucosa and thereby leading to UTI. So avoid using a simple splash of water works equally good. Apart from that, in males, again, maintaining good hygiene. Do not use antibiotics unnecessary. So that's about for taking care of the infection part. Regarding the part which is like malignancy, how to prevent, first we have to find out whether there is a risk factor or not. How do we know whether there is a risk factor, whether any of your family members had suffered from genitourinary cancer? It is always better to visit a urologist, consult him, get him into confidence so that he can keep a watch on you. The treatment for cancer is the earlier the diagnosis, the better is the cure. The later you go to the doctor with cancer, the more difficult it is for doctor to treat. If you are diagnosed in early stage, all cancers are 100% curable if you are diagnosed in the early stage. It is only when we have neglected that cancer and when the cancer has progressed to a stage where it cannot be completely removed, that is when it creates a problem. So if you have a family history, go visit a doctor. Few things which goes without saying is avoid smoking, avoid tobacco, avoid risk factors which are there for cancer. Next is renal stones. Renal stones, the most important dictum is drink lots of water. If you drink lots of water, majority of the time you're sorted. Okay, so these are the few things which you can do to prevent the cause of hematuria and hence thereby preventing hematuria.